Salger,
Present.
Sharma,
Present.
Simmons, Tedrick.
Okay, we do not, a quorum is not established because we don't have 5 people here in person, even though trustee Salvo is by Zoom. And we do not have an in-person quorum as required and are unable to take any action at this afternoon's meeting. However, we still want to hear from our presenters as set forth on today's agenda, so we will proceed with the open portion of our meeting as listed on today's agenda, since they are informational reports and do not require action. First of all, there is a public question and comment portion available at today's meeting. Madam Secretary, do we have any speakers?
No speakers.
Okay, the first item is the presentation by the SIUC Med Prep Program. Dean Cruz, will you introduce this item?
I sure will. So the Med Prep program is here on the Carbondale campus, is part of the School of Medicine. And just to put things in context, if you can account all of the learners, faculty, and staff of the School of Medicine, we have more than 3,200 people, but about 600 of them are here on the Carbondale campus. So that includes, well, the medical students, 72 for just the first year, and then 8 for all four years, the physician assistant students and program, the Carbondale Family Medicine residency program, our basic science departments of biomedical science, which includes biochemistry, physiology, anatomy, neurosciences, post-baccalaureate program, administrative offices, and the Med Prep program, the medical dental educational preparatory program that's actually been at the School of Medicine now for over 50 years under the able leadership of Harold Bardo and then Annika Metz, and now Dr. Randy Burnside, who's here today. So you'll hear presentations from Dr. Burnside and from 3 students in various levels of training. And there'll be plenty of time for questions as well. And I might have a few more comments myself. But first, I'll tell you a little bit about each of the students and Dr. Burnside as well. So you'll hear first from Dr. Burnside, and Dr. Randy Burnside. He's the director of Med Prep. He holds academic appointments in the Department of Medical Education and the Department of Population Science and Policy at the School of Medicine, and an appointment in the School of Education at SIU Carbondale. He's originally from Philadelphia, Mississippi, has a PhD in political science from the University of New Orleans, and is a nationally recognized contributor and consultant on leadership, cultural competence, and implicit bias, with more than 2 decades of teaching and training in these areas. He's also widely cited in academic and popular media circles as an expert on disaster behavior and policy. So next to Dr. Burnside there is Nicholas Weems, who's a graduate of the Med Prep program and is a first-year medical student here at the School of Medicine. So Nicholas Weems was born and raised in Carbondale, and he's a terrier, a graduate of Carbondale Community High School.
I like them already.
So there's more to like here, as a matter of fact. He got his bachelor's degree from SIU Carbondale in civil engineering. Engineering is a great background for medical school, you know, decision-making, problem solving. He worked in that field for the Missouri Department of Transportation for several years, and then he decided to pursue his true passion, medicine, by enrolling in the Med Prep program. The path wasn't easy or traditional, but through perseverance and support of the Med Prep program, he's now proud to call himself a first-year medical student here at SIU. Next to Nicholas is Christian Stanford. She is a second-year Med Prep student. Christian graduated from Vanderbilt University in 2018 with a degree in sociology. Since then, she's gained extensive healthcare experience, get this now, as a clinic manager, a medical scribe trainer, a medical assistant, and a research assistant. She's originally from Birmingham, Alabama, and she brings a unique perspective to her medical pursuits, blending a love of hiking, visual arts, and reading with a really deep commitment to addressing systemic health disparities. Passionate about the intersection of food insecurity and health outcomes, she aspires to become a physician who treats patients holistically while addressing the broader societal factors impacting well-being. She's dedicated to fostering patient care that is as compassionate as it is comprehensive. That's great. And then next to Christian is Taylor Gaines. So Taylor is a New Orleans native, graduated, you might see there from Xavier University of Louisiana in
We need to
May.
get her an SIU.
You know, it's pretty much the same course.
Dr. Burnside.
She has a bachelor's of science degree in psychology. You know, we like to do recruiting in any way that we can. Good stuff. So she decided to continue her education at SIU School of Medicine Med Prep program. And she is currently a first-year medical student at the School of Medicine as well. So Taylor's aspiration in life is to be of service and to give voice to underserved communities. And she plans on doing this by becoming a maternal fetal medicine physician. So MFM physicians are obstetrician gynecologists who get fellowship training in perinatology and care for the women with the highest risk and most complicated pregnancies. So she has a great passion for that, and we've already connected a little bit. So we've got a little kindred spirit on some of these things. So with that, I'll turn it over to Dr. Burnside to begin.
All right. Good afternoon, everyone. First of all, thank you for allowing us to be here. And in particular, I want to thank Chancellor Lane and Provost Tucker, because I know traditionally this is your spot to highlight a program that is under your leadership here on the Carbondale campus. And so I'd like to thank both of you for allowing us to have this time to have this conversation. But I would also like to say from the outset that while we report directly to Dr. Cruz, there's a lot of collaboration with us, with a lot of faculty and staff on the Carbondale campus. And so let me thank a few of those people. Like I said, I want to thank Chancellor Lane and both the provost, but the registrar's office here on the Carbondale campus does us great service. The admissions office here does all of our admitting the students because they have to be admitted to this campus first. So the admissions office does a great job. The graduate school does a great job because there's a graduate component to med prep where students can get a master's in biomedical sciences, and they do a great job making sure our students are enrolled and making sure that they're properly taken care of and getting the course requirements to be able to graduate. So there's a lot of collaborative work that takes place outside of the medical school that the Carbondale campus does for us by virtue of us being here on the campus. Also the bursar's office, need I not forget them because they work closely with us as well to make sure that the students are taking care of their financial obligation and helping them as much as they can and being as flexible as they can in that area. So there's a lot of help here on the Carbondale campus, and I would be remiss if I didn't mention those people and thank them up front for that. But what I want to do, and as you heard, something you may have consistently heard about these students is the underrepresented nature, the type of care that they want to give, and that is highly representative of the School of Medicine. So Med Prep being a part of that, we look for those unique types of characteristics in students that we are recruiting to the program and admitting to the program. They need to be able to articulate that. And these three students are excellent examples of students who we look for and are capable of articulating the School of Medicine's mission, even without knowing they're articulating the School of Medicine's mission. And so those are the types of students we look for and want to attract here and bring here. And so I'm thankful that they're here today. And so I thank them. I want to thank them publicly for taking time out of their study to be here. A lot of testing going on, a lot of finals going on right now. So they're taking some time to be with us here today. And I want to thank them for taking that time. Now we can move to the PowerPoint here. If I can see it, that would be really helpful. That would help me in my presentation. I could talk without it because this is such a wonderful program, but you guys to have the opportunity to be able to see it. And so this picture here, and I will mention something about each picture that you see in this PowerPoint slide because they're all important. This picture here is a picture of the first year cohort of medical school students that came from Med Prep this year. As you can see, there was 11 or 12 there. Was it 11 or 12 you guys? 12, 11? Somewhat nice.
11, I think.
It's 11, I believe it's 11. But so that's a picture of the first year medical school cohort, all that came to Med Prep. So they came to Med Prep for 2 years, and then they continued on to our medical school. So 11 students last year continued on from Med Prep to our currently first year medical school students. So you can see that's a picture of them there. We can move to the next slide because I want to talk to you a little bit about Med Prep and what it is. So the Med Prep mission is here. most of you hopefully can see that. I won't bore you by reading from a PowerPoint to you, but it's important to kind of understand that we look for socioeconomically and educationally disadvantaged students with a particular interest in underrepresented students, obviously, and a particular interest in students from central and southern Illinois. And so that's really the population of students we're looking for. Those who are educationally challenged, those who are socioeconomically challenged, those who are underrepresented in medicine. That's really the population of student that MedPrep focuses on. And we pay particular attention to central and southern Illinois. And so we offer a structured program and all that information is there. But what's important to understand about MedPrep, as Dean Cruz pointed out earlier, it started in 1972, right after the inception of the medical school. So for those of you in higher education circles, you know there are 350 postbacks in this country if there's one. This was one of the first ones. And this is one of the only ones that has the deep commitment to the description that I just gave you, right? Most of the postbacks in this country are chasing money. They do help students, but they're also chasing money. The good thing about our program and what you guys do as trustees is that it allows us to have a program that's not chasing money. Not that we are averse to money. We like it just like everybody else does. We do like it. But it was never created on the basis of making money for the institution. It was created on the basis of training health providers for central and southern Illinois, and knowing that there would be people who needed that additional help and attention to get to the level of being able to be successful in medical school and dental school. And so that's what it was created on the basis of, and that's what we continue to honor today. So not to talk about anyone else and why they created those programs, but ours is a little bit more unique in its creation and in what we do and what we accomplish. And so as part of that, there are alliance agreements. And so with the initial creation of MedPrep, alliance agreements mean that the student, if they successfully complete our two-year MedPrep program, they have a seat at a particular school. In this instance, if these students complete, they have a seat at the medical school. So that alliance started in 1998 with our own School of Medicine. We have a linkage program that started in 2013 with Dartmouth Geisel School of Medicine. So the linkage program is if students have a particular MCAT score and record, Dartmouth will interview them and oftentimes offer them an opportunity to attend there and oftentimes offer them money to attend there. Now, you may say, well, why would we allow students from SIU to go to Dartmouth? Well, one, it is Dartmouth. That's important to understand. The second part is it allows students an opportunity that perhaps are a bit of a different fit for someone else to not necessarily have to come here. You know, Dartmouth is a really different medical school than SIU. And what I always tell students, I was like, if you want to be a great doctor, if doctoring is your thing, SIU is for you. If doctoring is your thing. But Dartmouth has way more research and all this kind of stuff. And there are these people who really are in the research and a lot of that, not that we don't do research at SIU, we do it and do it well. But Dartmouth has the money and the resources and all of the things that go with that to do it better. And they also offer students a nice package. So we have that agreement. That's the only type of agreement we have with any outside entity like that. We have an alliance agreement with the SIU School of Dental Medicine up in Alton, and we got that in 2021. In part, I know that Trustee Simmons is not here today, but if he were, I would thank him for that because he played a pivotal role in ensuring, along with Dr. Cruz, that we got that agreement with SIU School of Dental Medicine because he made a call. As I like to say, one call, that's all. He made a call and the process picked up exponentially in getting that process done. So we have that alliance with SIU School of Dental Medicine. And then we have an alliance with SIU School, that shouldn't be dental medicine, that should be the PA program. So oversight on my part, but we have an alliance with SIU PAA program that Dr. Cruz, again, is responsible for because we sat down and talked about what we were doing in terms of other areas and really saw PA as an area where our program could really assist them in some of the recruitment strategies and some of the things that they were trying to do to make their program more equitable. And so that's kind of in terms of Med Prep, that's kind of what we're looking at. This picture here is a picture of Med Prep alums from SIU, all School of Medicine students who are now in residency. So they have graduated from SIU School of Medicine. Dr. Cruz probably recognized some of them. And they're all in residency. Now, here's the wonderful thing about this too. So they're all in residency, but you have people there that are in residency, Mayo Clinic, Duke, right? So they're getting great residencies. If you know anything about residencies, they're not just in residencies, they're in great residencies. So they came here as Med Prep students, went through the Med Prep program successfully, went on to the medical school successfully, and now are successfully completing residencies. And this picture was taken at the Student National Medical Association meeting. And if you mention SIU and Med Prep and students at that meeting, our students play a pivotal role in the Student National Medical Association. Med Prep alums play a pivotal role in that organization. And so that's an even greater extension of SIU School of Medicine, but also the Med Prep program, because there's a great amount of influence that they have. We can move to the next slide. So let's talk a little bit more specifically about the last 5 years. So I've been around for almost 5 years as the director of Med Prep. And so we've tried to accomplish some things and do some things and enhance some things. And we'll talk a little bit about that as well. We've talked about it a little bit already. So over the history of Med Prep, there have been 1,731 students. So that's the total number of students that have participated in Med Prep. So if we do a last 5 year snapshot, we have an 89% completion rate, and 82% of these students entered medical, dental, or other professional schools after completing Med Prep. Now, let me break this down a little bit for you. If you look a little further, 87% of the students we have who have come through Med Prep were underrepresented in medicine. So there are people who will give you gaudy numbers about the number of people they send to medical school every year. But those are an overwhelming majority of those students don't look like this. They do not look like these students. And one of the things we pride ourselves on at Med Prep and at SIU School of Medicine is when you look at our cohorts and you look at what we do, you see equity. Right? We pride ourselves on being equitable in that. And so 89% completion rate, 82% enter medical and dental school, 87% of these students over the history of the program have been underrepresented students. 62% female, 38% male. We're working on that 38% male part. We'd like to see that number grow, but almost every medical school in the country would like to see the underrepresented male population at their medical schools grow. And I think we're doing a much better job of it than most schools in the country, because somewhere around 2.5% to 3% of medical students are Black males or something. It's really low. I think last year I heard a number that, I forget what the number was, but it was a really small number. I was floored by it, and it has. So we have an initiative at Med Prep, in-house initiative, that we really encourage the application of and support of underrepresented male students, because we know how important that is to medicine generally, right? And to underrepresented populations specifically, because many of you may or may not know this, but one of the things that's important is African Americans have better health outcomes if their doctors are African American. That has been proven through research, that if their doctors are African American, they have better health outcome than African Americans whose doctors are not. And so there's a lot of research out there on it. And I think that that's important, and it's important for us to understand that. The other thing that we're doing is, which is interesting, is 36% of the participants throughout over the last 5 years have been Illinois residents, right? So 36% of the participants, so a little over a third, But I think one of the most important things was when I was looking was 17 of those students returned to Illinois after leaving Illinois after they graduated from high school. So we're actually bringing students back. We're like the third highest exporter of students as a state to other states. I don't know how many of you are familiar with that, but we export a lot of students to other schools. But we're actually bringing them back because of the med prep program. So students are re-entering the state, going to med prep, and many of them are continuing on to our medical and dental school, which I think is a great thing because they're now coming back to the state and are more likely to stay in the state after they get the professional education, as opposed to the state that they moved to get their undergraduate degree, which is what trends say typically happen. Once a student leaves the state, it's hard to get them to come back, right? So I think all of those things are really valuable and important in what we do. And we put an emphasis on recruiting Illinois kids. So I want to be clear about that, and especially central and southern Illinois kids. We put an emphasis on that, even if they're out of state. And I do a lot of the recruiting. If I'm talking to them, I'm really talking to them because I always say to them, well, then you know who we are, and you know where we are. So you need to come home, right? I was down at Ole Miss 2 years ago talking to students down there, and a couple of students did come back home, and they weren't underrepresented students. They applied to SIU, and I know at least one of them got admitted to SIU. And so it's important to me, and I think for us, to encourage those students who are leaving the state to come back to these professional programs that we have, graduate programs that we have, to try to get those students back that are actually, and we enjoy doing that at MedPrep. We can move to the next slide. So you may ask, what do we need MedPrep for? Why do we need programs like this, right? Well, there are a lot of reasons, and I put a few of them up here, but there are a lot of reasons. One big reason is either poor advising or no advising. This is particularly true in science and in pre-medicine. So in pre-med, it is particularly true. And not just in our system. We don't have the greatest advising in our system, but it's a systemic problem. It's a national systemic problem of poor advising to pre-med students. Most places don't do it well. And so that's one of the biggest barriers, and in particular for underrepresented students. It's not great across the board, but it gets even worse for underrepresented students. And then let's talk a little about bias. We all know about bias, and I just put all the isms you can think of. Well, that's a barrier as well for people. Academic challenges. Medicine is not the easiest journey, and the coursework to even get a chance at medical school in many instances is not easy for a lot of students, particularly with a lot of the places where we get undergraduate students from, the high schools that they get them from. And I know Chancellor Lane, does a lot of going out to high schools, local high schools, and going to places and visiting kids at these schools. I don't know about Chancellor Minor or the provost, but I do know that you guys know about some of these schools and some of the holes we have to fill when they get to college as undergraduates. Medicine is so competitive. If you're dealing with students who are struggling in their freshman and sophomore year, they become less likely to get into these professional schools because those grades hold them back. Because grades become an important factor in determining who gets the opportunity and who doesn't. Well, if you don't do well in those first couple of years, it's problematic. And so you also have socioeconomic status, isolation, poor undergraduate college choice. And I put that up there for a reason, because in medicine, a lot of times the undergraduate institution that you or your family choose really dictates how well that pre-med program prepares you for things like the MCAT, for things like medical school, right? Or dental school. It really dictates that. And if you're not at a school that does really well at that, that is also a barrier for it. Limited medical exposure, and also being routed to other areas. But also when you look at lower socioeconomic status, one of the factors there is not so much the status itself, but the fact of what the student has to do. So they're working 20, 30, 40 hours a week. How many of you know kids who work 20, 30, 40 hours a week and have a 4.0 GPA, 3.9 GPA in biology or chemistry or biomedical sciences? Probably not, right? But they also, if they're working all those hours, they're also not shadowing. They're also not going on medical missions to wherever. They're also, not in a lot of pre-health clubs or activities because they're working. And so these are all barriers for a lot of students that we get at med prep who intellectually are very strong, but who are opportunity very limited, right? So intellectually strong, opportunity limit them, and so they have to look for alternative paths to live out their dream. Okay, so let's talk a little bit more specifically about our program and the cohorts that we have right now. So our first year cohort this year is 24 total students. We have 20 medical, 3 dental, and 1 PA student. So this year we have our first PA student for our PA track, and she's doing really well. I just met with her right before coming here, actually, in our end of semester meeting, and she's doing really well. And she'll be hopefully in the PA school starting in the summer. We have 20, like I said, 20 medical, 3 dental. This is the largest dental group that we've had in a while with 3 dental students. And so they're doing really well as well. In our second year cohort, one of them, which is here with us today, Christian, we had 17 total students. We had 15 medical and 8 have met the SIU School of Medicine aligned requirement, which means if they choose to come to SIU, they have that opportunity. Now, some of them will get opportunities to go other places. I do everything I can to encourage them to make the best decision for them, but also to remember who has been loyal to them and help them to get to this point. So I try to be as unbiased as possible, though, but really kind of guiding them and letting them know, hey, really think about what that next step is going to be and think about what you've experienced here. And I think in my time at med prep, and I think Dr. Cruz knows, Dean Cruz knows this as well as everyone else, we had a growth in the number of students choosing SIU School of Medicine.
Yes. Big time.
And I think it's in part because of all the work that happens here on the Carbondale campus, how they're received here, how they're treated here, and then how we as a program help them to understand what it is they need to do, but also the collaboration that we have with the medical school, and the faculty and staff from the medical school really embracing their role in helping to mentor the students and helping to guide them in their approach to medicine. And I think, again, but on the front end, we're choosing students who have a very similar belief to what SIU School of Medicine's vision is. And so once they get here and they see it, they can embrace that, knowing that it's very similar, right? So we have 8 who met that alliance. We have 2 dental students and 1 having met the SIU School of Dental Medicine Alliance requirement. So again, we're making progress in those areas. Now, our cohorts are somewhat smaller now than they have been in the past, for a variety of reasons. Greater competition by all these other programs that are being created, being quite a bit more selective in the students that we bring here because we want students to really be successful. And so we want to give them the opportunity. But financially, things have not been great financially for a lot of students and a lot of families over the last 5 to 10 years. And so it's a huge financial commitment for students to leave New York. And I say New York, but we have 4 students from New York this year, to leave New York or to leave Birmingham or to leave New Orleans and to come to Southern Illinois to come to this program. But we have those students coming to this program because of how popular this program is outside of Illinois. I would argue to some degree this program is more popular outside of the state than it is in the state right now. We're working to do something about that, right? We are working to make sure that every Illinois kid knows about this program who's looking to go to medical and dental school. But it's important to understand that we have space to grow the program more and to create the doctors and the dentists and the PAs that are more representative of the population. Next slide. So student placement, over the last 5 years, 78% of students have continued on to medical and dental school, as I pointed out. So there's been 122 students who completed the med prep program. 95 of the students were accepted to medical and dental school, 70 students met our School of Medicine Alliance program, bar, and 48 of those students, 48 of the 70 enrolled at SIU. I'd like to see that number higher personally, but I think that that's pretty good, given how much they get recruited by other schools. So to be clear, schools with a lot more money than SIU, School of Medicine, come here and recruit these students. Email them, call them, when they see the nods over here, sitting along the wall, yeah, they promise all kinds of stuff, you know. They come here and recruit students, and so sometimes students get a great deal, you know, get a great deal, someone tells you, you don't have to pay them. That makes a difference, right? Especially when you maybe come from a lower socioeconomic status family that doesn't have the type of money or wherewithal to shell out hundreds of thousands of dollars for medical education. All right. And as you can see here, here's a list of just some of the schools over the last 5 years. And I said some of the schools that students have gone to. This is just, again, a list of some of the schools that they have attended over the last 5 years. And so it's important to kind of, again, to understand that these students are viewed as really valuable students by other schools. And rightfully so, because they're all excellent. Next slide. So I want to talk a little bit here on this final piece here about student activities, because our med prep students are also a part of this community in Southern Illinois, and they do things as a part of this community that I think is important to highlight, because many of our students are really community oriented, community centric, and want to have a role and a place within the communities that they're in and serve those communities. And so the Med Prep Club averages over 200 volunteer hours per year as a group. They do things like winter clothing drives. They help with any of you who are local, Victory Dream Center, which is a local food pantry place. They help with back to school drives, in particular with Hopewell Missionary Baptist Church, one of the biggest back to school drives in Southern Illinois. They help with that particular program. And last year we had a really unique thing that happened. One of our students, Briar Kirksey, she's a second-year student, and she has Medal Lines for SIU School of Medicine. So if you see Briar around anywhere, be sure to encourage her to stay with us, because I think she's a great student. I think she's initially from Rhode Island, but she's also a Xavier graduate. I know Taylor's over there. But she spearheaded the No Woman Forgotten project that they did last year as a group, which collected, how much did they collect? Those thousands of items of feminine sanitary products for women who are incarcerated in Illinois prisons, and then worked with our own correctional medicine office to make sure that those products were distributed to prisons throughout the state for women who were unable to purchase those products themselves, to make sure that they had those sanitary products. And so I know everyone was excited about that, and our students did that on their own without us telling them. I think they were in a class and they were talking about just different things and different needs, and they took it upon themselves to say, we're going to raise this money and we're going to donate these products, because sometimes these women are forgotten because they're incarcerated and kind of thrown away to some degree by society. So that was a great project that we did. And like I said, again, correctional medicine really embraced that and helped to make sure that the products got to where they needed to be. And so those are the kinds of stories and things that happen that sometimes we don't hear about, but that are great, because remember, a lot of times we hear negative things about young people, but these are young people who are making a real difference in the community. And I really wanted to highlight the kinds of differences that they make and how committed they are to community and to community health. Also, you may, if you're in the area, see some of our students shadowing. Over the last 3 years, more than 20 students have shadowed with their own family medicine residency here in Carbondale. So we also have had students shadow with Christopher Rural Health Planning Cooperation's office up in DuQuoin, Dr. Cheryl Smith, who is the director up there. really encourages our students to come and shadow with her in rural medicine so that, you know, kid from New York can get a real feel for rural medicine, right? They may not really understand what it is and want to understand what it is once they get here. So we give them those opportunities to really shadow and see what rural medicine is about. We've also had some students shadow with some of our alumni up at Provident Health up in Cook County. We have some alumni who are in that hospital up there, and we've had students go up there and shadow with them who were from Chicago. The students are from Chicago, so they could go home and shadow with them up there and get some unique experiences up there. And so we really have spent a lot of time making sure we're building these types of relationships so that students are capable of doing that. I have one last slide here that I'll talk about, and that's outreach and recruitment strategies. And so one of the things that we've been doing over the last 5 years is really reaching out to make sure that people know that we're here, to make sure people know what our mission is, and to make the ask of them to help us to recruit students like these to come to our program so that we can continue the legacy of the Med Prep program in a way that adds to the healthcare personnel that's out there taking care of our families. And so I'm a part of the AAMC Action Collaborative for Black Men in Medicine in Illinois. So that's a collaborative that's we're really focusing on trying to create policies and opportunities around getting more African American men into medicine, because that's a really high need area. And that's AAMC is it's not the governing body, is it?
It's professional
It's
organization.
a professional
Support
support organization for medicine. And I'm also working with Creating Pathways and Access for Students, Success Foundation out of Chicago, which provides a lot of healthcare mentoring and resources to students who are interested in medicine. And so one of the things they're helping us do is provide resources to students, but also notifying students about our program and about what we're doing in the state, about our medical school, about our Med Prep programs, about our biomedical sciences programs, all those programs that lead to medicine. They're helping us in that area. The I Am Able Foundation in Chicago, we go up there every year because there are a lot of students who get mentored through that foundation who go on to medical school. I think this year we have the privilege of having 2 students that were a part of the mentoring program in that foundation in our Med Prep program. So that's really beginning to kind of pay off for us as well. One of the things we do is work with Illinois TRIO. So all the TRIO programs in Illinois, especially, we send emails out to, we give them information about our program, because we're trying to attract a lot of students who we're looking for are part of TRIO programs. Those are student support services programs at the institutions. And so we're looking at those. We're attending medical conferences as exhibitors. The Student National Medical Association, which I talked about earlier, which our medical students and alumni are a big part of. The Latino Medical Student Association, which some of our students participate in as well, but which we're also recruiting there for students. And so we're doing a lot of these things. So last year we contacted over 5,000 students via email, and we do that every year. And so we kind of look at lists and we kind of think about who these students are and who would maybe be a good fit for us. And we solicit them via email to say, hey, let's have a conversation. Let's see if we can help you, and to, think about what you want to do in terms of a post-baccalaureate program, if that's in fact something that you feel that you need. So we do that, and we again contacted more than 200 pre-med offices and TRIO offices across the country, but in particular, we try to reach out to all of the Illinois offices and all of those in the Midwest, in Indiana, Michigan, Missouri, Kentucky, Tennessee, all the bordering states. And so that's kind of what we've been doing, what's been happening, what we've been doing over the last 5 years, but it's just an extension of what's been happening over the last 52 years. And so as we grow and change and develop, these are the kind of things we're going to continue to do, and hopefully we're going to continue to bring these great students into the system, and they're going to end up staying with us and going to our medical and dental school and our PA. Thank you for your attention. And now I will have each of the students come up and give you, talk you a little bit about why Med Prep and why it was important for them. Nicholas, if you will.
Oh. Okay. Sorry about that. All right. How is everybody doing today? Good. All right. My name is Nicholas Weems, born and raised here in Carbondale, Illinois, as you all know. And I'm here today to speak about the med-prep program and what it did for me. My life growing up had been somewhat of a uphill battle, as I would like to say. Growing up, I almost lost my eyesight due to a freak accident on the playground. It was the help of an emergency medicine doctor in Murfreesboro that helped me to get the stitches and all of that reconstructive stuff that I needed in order to be able to literally look at all of these things. And I have wanted to always gravitate towards someone or an entity that showed me that same warmth and that same guidance and love, which I found in the med-prep program. When it came to office hours, they were always available, even after hours. When it came to extra help, always available too. And one thing for me personally is I actually have a condition. I have ADHD. I've been fighting my entire life, even my mother prior when I was younger, fighting my entire life to try to help me get that medication, but she was always turned away. I was always turned away as well when trying to get an adult diagnosis. It took a faculty member at MedPrep to connect me with a doctor who looked like me to finally get me the help that I need so that I could focus on my studies. And as a M1 medical student here at SIU, I can say I'm doing very well, thanks to all of the people involved. And I also am very proud to say that I'm one of the 1,731 students completed the program and are representing, Carbondale and SIU. That's what I'm saying.
Congratulations.
Yes, thank you.
Kind of hard for me to follow the M1. I'm sandwiched in between two people. But like Dean Cruz said, I went to Vanderbilt. I studied sociology with a focus in labor history. So I know you're probably thinking, well, why are you even here? I have always had a passion for medicine, but unfortunately, like Dr. Burnside said, the advising that I was given when I was at Vanderbilt was maybe not the best. They were like, oh, study something that's completely different. It'll make you look really attractive in applications. And wow, surprised that was not the case. And then at home, I'm the daughter of two people in the financial sector, so they had no clue at all what I was going through. So I applied to medical school my first time, my third year at Vanderbilt, and I applied to 15 schools. I didn't even get a call back from 8 of them. Like, I was so out of my depth. So I moved back to Birmingham. Well, as Dean Cruz said, I did a litany of ancillary jobs in medicine to try to see if this is something that I was still passionate about. I even did research. I moved to Australia for a couple of years. I did labor history research too. And then I moved back to Birmingham, started a graduate program, a master's in biomedical sciences. And then unfortunately, a global pandemic hit, and my grandmother was diagnosed with pancreatic cancer. So I was working 2 jobs and working as a caretaker for my grandmother in the midst of a pandemic. And one of my mentors said to me, I think you're lost. I think you're in this kind of state of arrested development. Like, you need to do something. You need to move. I know you have this passion for medicine. I know you want to do this. Like, you have to figure out what that looks like for you. But I have this golden ticket for you. My daughter was, his daughter was a practicing attorney, and she went through the med-prep program as a career changer, and she's a successful physician. She lives in New York now, but he was like, just apply. What's the worst that could happen? And so I applied, not really knowing a lot about the program, but being hopeful and kind of curious. And in the waiting period between applying and hearing back, I did some digging. I looked on Reddit. I know you hate Reddit. But I looked around to kind of see what the buzz was about this program. I was like, I've never heard of this before. I was already involved in a post-bac that went bust because of COVID. Like, I'm not really interested in doing that again. I don't have the money to do that. I was working 2 jobs just to support myself while living at home. So I was like, ugh. But in that space of time, I found out like just countless stories of successful alum from med-prep. Countless stories of people and like the life-changing transformation that they had while in this program. So I was in Daytona, Florida at Bike Week, actually, when I got the call from the I look like a motorcycle rider. I'm not. I was just there because it's the beach. And I got the call that I got into the program and I was over the moon. Like I had to move in like 50 days to Carbondale from Birmingham, which was crazy. I had no idea what this place was like. And I was like, just like floored, completely out of my depth again, because I had no idea what I was getting myself into. Not only did they want me to not work, they wanted me to be in class all day, every day. They were asking me huge questions like, why medicine? What is it that you want to see change in the world? Like, what's your passion for what you're going to be doing in the future? And I had never had to answer those questions. It was, what grade did you get on that test? Or do you feel like you'll be capable of the patient load? Do you feel like you'll be capable of the course load? So they poured into me academically. Obviously, my science foundation was improved significantly, as evidenced by my MCAT improvement, but also they poured into me professionalism. That was something that was really focused on. And then personal growth too. Like I know Nick mentioned that in office hours, sometimes office hours were like, oh, here's a chemistry question, can you answer it? But a lot of times it was, hey, this comment you made in class, let's talk about that. Or what's going on at home? Or do you have all the tools that you need to succeed in this program? So I think those were maybe some of the gaps that I really needed. The discipline, yes, the science background, of course, but maybe the professionalism and the personal growth that I wasn't getting in other aspects of my life. So I think that's honestly what MedPrep has done for me. And now I'm in the interview process, and it is amazing to me, even still, the impression that I get from admissions counselors, from deans of other schools when they hear that I'm a part of the MedPrep program. Just seeing the face change. I was actually at the SMMA conference a couple months ago, or last month in Chicago, and when I introduced myself to people and said that I'm a part of MedPrep, just to see that like light bulb moment of like, oh, okay, wow, we've heard of you. We've had students from your program that are involved with us. We have residents from MedPrep, that kind of thing. So I'm super, super thankful. It's been a real boon to my success for sure.
Kayla again. I'm from New Orleans and I attended University. So a little bit about my background. I went to inner city school, elementary, high school my entire life. But I still did good enough to be able to go to college. And I worked really hard, but then when it came to the MCAT, it wasn't just working really hard. It's like, do you have that academic confidence? Do you know how to approach these questions? And I thought I could, and then I went. It didn't really go that well. So then I was forced to think about things outside of what my plan was. Because your plan in life is, I'm going to do this, and then I'm going to do this. It's all linear. It's not any curves. So I had to sit down with my advisor and figure out what I was going to do. And I thought I had it all figured out. I had this whole list of, these programs, and this is great. She's like, yeah, MedPrep, have you heard of it? And I'm like, no, but I just talked about this program. And I didn't know that program was going to actually frame me into the student that I am today, to be able to call myself an M1. So going into MedPrep, I didn't really know what I needed to work on, but I knew something was wrong because there was a gap, and I knew medicine was something that I had a passion for. So how am I going to get there? And through the 2 years at MedPrep, I found out my issue was really academic confidence. I think because I didn't have really many people around me doing what I was trying to do. And when I would go into situations where there's a lot of people trying to go into medicine, nobody really looked like me, So I just felt like maybe I'm not smart enough, or I'm not good enough. And I think MedPrep showed me you are smart enough. You just need to think about it like this, or these are some resources that might help you. What is your learning style? You've been trying to do it this way, but you actually learn best this way. And then also, I think I've had a passion for community interaction, even since being here. Like, I'm super involved at a church home. I volunteer at Lewis Elementary, like once a month, like Victory Dream Center. Like, I'm super community oriented because I like to interact with people. Like, that's my passion part of medicine, the people. But I did that a lot in undergraduate, and I think that hindered my success as well. So you have to know your limits. You can't be involved in everything. And that's something I didn't identify then. So MedPrep helped me grow academically confident and also knowing my limits and what balance is, because I had none before. And through MedPrep, I was able to get alliance with SIU and also get into a school at home at LSU, Louisiana State University Medical School. But I chose to stay here because the environment is special. It's not something that most med schools have. It's like home. We have Kathleen, I don't know if you know Kathleen, but she's wonderful. She's like a grandmother. Love her. Everybody just really cares about step by step. What are you thinking? Down to the coordinators of the curriculum. I can go talk to the co-director of the curriculum and tell them how I feel and my thoughts. And that's not something every medical school has. And I really appreciate being able to have this opportunity and learn in an environment that I have. And I don't think I would have been as successful in another medical school that's so intentional. So I love MedPrep. I love SIU School of Medicine, even though I don't have a sweater on right now. But yeah, that's all. Thank you.
Well, I don't have a question, but I have a comment. When I was appointed to this board in 2015 during the height of the budget crunch, where higher education was not getting much funding. One of the first calls I got was from a good friend and longtime trustee of this university, Bill Norwood. And the first thing Bill told me, he says, "Phil, I don't care what you do, but don't touch the med prep program." Well, I didn't know what the med prep program was. I thought that was something you did before you had a colonoscopy. Well, he explained it to me and how benefit it was, how wonderful benefit it was. Well, that's true, you know. And what benefit it was to the students, and to the medical school, and how it was providing a service and providing doctors that in many places were unrepresented, and what a wonderful program it was. And he explained it to me. But then I got a second call from my neighbor, who is Harold Bordeaux. And Harold did the same thing. Whatever you do as a trustee, do not touch the med prep program. And guess what? We haven't. And I'll tell you something else, we're not. All right, I mean, it has just been a very valuable program on this university and you know, Trustee Simmons, we got it expanded into the dental school. And it is a program that I think other colleges and universities are jealous of myself. So I want to thank you and these students, especially I like that one from Carbondale. I'm a terrier too.
Yes.
So anyway, but thank you very much. I don't want any other questions or comments from any of the board members.
Very informative. Thank you. You're doing a great job. Keep it up.
Can I brag?
Yes.
Dr.
Yes.
Burnside? I get to see him all over campus interacting with not only your med prep students, but students in general. So you got a great leader here. And it's so refreshing to hear and see Dr. Cruz and his team work so hard. Because when you hear that percentage, it kind of hurts a little bit. That whatever percent for African Americans, and I didn't know that. So what you're doing is changing the world. You guys are phenomenal, right? You're part of that talented 10 that we talk about all the time, right? So I just want to thank you for what you do and how hard you drive when you're here. And I too heard about this program in Houston because a lot of your med prep students went down to
They
Houston.
did indeed.
And that's all they talked about when they found out I got this job. When you hired me, I said, guess what? Med prep and Dr. Bardo. So I congratulate you guys for the work you're doing. Great job.
Thank you.
And Randy has come a long way. He was in political science before.
Yeah. right.
From political science to the background.
I agree with you.
Yeah.
I've come a long way. I don't even like to think about that. I don't even like to think about that.
Good job, that's what I said, you're doing a great job.
You know, I'll just have to say, under Dr. Burnside's leadership, the Alliance program for the School of Medicine has really taken a step up, and the quality of the students is phenomenal. They're doing astoundingly well. Actually, we just recently looked at all 320 medical students that we had right now. And 12.6% of them are African American or Black. Now, that doesn't sound like very much, but if you exclude the 4 historically Black medical schools, Meharry, Morehouse, let's see, Charles Drew and Howard. And compare that percentage to all other medical schools historically in the last 5 years. 90th percentile is 10.4. We're 12.6, so that's above 95th percentile. And it's probably just one other school and the SIU School of Medicine who are at the top. And this program has allowed that to occur with the highest level of quality. I mean, astounding. And so it's great. Yeah. So thank you.
And I would add to that, that there are a lot of medical schools in Illinois that are thankful to, particularly UIC, who has a lot of med prep alums. They probably have 18 or 20 med prep alums throughout their 4 years and across their 3 campuses right now. And so not only is SIU benefiting, but the other medical schools in Illinois know about med prep and actively recruit students from med prep to their medical school. Now, my goal, obviously, cover your ears, is to keep as many of these great students here as we can, and to bring more great students here. One of the challenges we have, multiple, obviously, you know, you can always come into a room and ask people for money, right? Well, we need more resources, and probably one of the biggest resources we need is really, that's going to help us, I think, across the system, but also I think here on this campus, is that we're spread out across campus. And I think at the best schools who do medicine, pre-med stuff, they're all in one space. So you have all of your sciences, all of your pre-med, all of those professionals like schools, they have one space. We don't have that here on campus. And so we have undergraduate students who will say to me, I've never heard of med prep. Well, we were all in very similar spaces. I've never heard of our post-bac in biomedical sciences. The medical school is, there's part of the medical school in Carbondale, and I'm not making this stuff up. We have students who are interested, who are saying this. And I just think for us, if we could have a big enough space where we bring all of these people together under one roof or in one complex, it would really, I think, enhance our ability to affect change in central and southern Illinois by growing our medical health professionals in this region. Because we have so many students. I met an African-American student last year who's now at Brown. She's in medical school at Brown, but did not really know a lot about SIU School of Medicine and how we're internationally known for a lot of stuff, right? And didn't even apply to SIU. And I met her after and she was like, oh, I didn't even know all of these things, right? And I think it's incumbent upon all of us to try to educate everybody, but it is really hard on a campus this large to do that when you're not in the same area as these students, right? And many of us are not in those areas. And I think our med prep students do a great job in talking to undergraduate students sometimes as they run into them in class and in other places and telling them about the program. And we've gotten students to come talk to us about that. But I think one of the things that would really help us would be in some kind of way thinking about how we can bring all of us together. Because I think that would really enhance what we do across the entire campus in terms of medicine.
Thank you, Dr. Burnside, and especially thanks to the students. You make all of us proud.
And thank all of you for listening and allowing us to have this opportunity today.
Okay, the next item is the update on the review of the Board of Trustees legislation, Dr. Stuckey. Now you have to go back and study.
Yeah.
They get up here, they don't talk to the back of anybody. Oh, how do we already decide I should follow that? It's hard to follow something like that, and y'all recall this section is primarily directed to board members. We are going to give you some material to review. You recall 6 months ago, Paula, and Bill Crater and I started a project of reviewing board policy and trying to clean it up, revise it, make it more clear, make it better than it was before, because we had been witnessing for months and months and years that there was a need for change. About 6 months ago, we took the smaller section of board policy that we're going to deal with, gave it to the board, had it redlined, talked about it at a session like this, and then left it with you from that board meeting to the next, so you could read it, review it if you wanted to, and at the next meeting, we presented it to the finance committee, and then of course sent to the full board for approval. That's what we're intending to do today. The last effort was I think Roger Chadwick said it was boring as the devil. This isn't boring, but it's tedious. This time the last section, we hit the procurement section of the policy. This time we hit the HR section of the policy. And it's a much larger section. It's much more complicated and convoluted and goes a lot of places. And so this is a lot more reading, a lot more study. If you look at the document before you, if you turn to the first page, we felt it was important to give you some help as you read this document. It's not put it in context. First of all, the board policy doesn't stand by itself as an administrative tool. About 20 years ago, the administration started developing a document called the University Guidelines. And these were how-to sort of things, procedures sort of things. You might know that a lot of universities have policies and procedures documents. We have policy documents. We had policy documents, but we didn't have the procedure documents to say how to and how do you get this done. And over the period of years, that has developed quite a bit of a document. Had much in that document, the procedures guidelines had more interaction with the HR policy than it did with the procurement. And so when we were doing this and we were reviewing this, there was a lot of interaction between the two, and we found that there was a number of places where things ought to be taken out of policy and put in procedures. So you see in the contents, there are 3 sections. One is, the first section is the outline copy. That is the policy as it is and shall remain as core policy. We did take the intellectual properties section of that out. It was a fairly major part of the policy, and it wasn't written the same way. It was written by a committee, and it seemed more like a dissertation than it did a policy. It obviously is important and needs to be retained, but we kept it separate because it didn't fit in terms of the way it was put together. And then the last section of this content at the bottom talks about university guidelines. The first one of these guidelines is a guideline that already existed, and we revised it because we were going through and revising the policies themselves, and this guideline was effective. But we developed 4 new guidelines to be added, and these took material from the policy and put them into guidelines. So what you'll see is that the policy has shrunk some, but we have more guidelines. There's a lot of reading here, there's 26 pages, but, that they basically, almost all of it is trying to make the policy read better, be more understandable, and be simpler. There were 2 changes to the policy, 2 significant changes to the policy. And they are outlined here in this content document. And you can read those and study those as you go through the documents themselves. I didn't intend to be much longer than this. I just wanted to give this to the board, give a little bit of a background and let you go through it. Any questions? We'll expect them to take this to the board in the February meeting for approval.
By the fact that we're receiving this today, does that mean President Mahoney, you opined on all this?
Yeah.
100%?
Yeah.
For your support, thank you.
Have the chancellors looked at it also, or?
I don't know if you have yet, so we'll get you a copy of it.
Yeah. We work primarily with staff at the personnel level. We work with
Human
personnel
resource
officers.
Yeah,
director,
yeah, yeah.
everything was.
The
The people on the
vetted through
campus
director.
have it, chancellors have it, but we'll get you a copy of it.
Well, thank you, Dr. Stuckey.
Thank you.
Okay, that's the end of all of our presentations, and that concludes our matters this afternoon. Thank you, Trustee Souter, for hanging in here with us, and sorry,
good.
I'm doing this for lunch, but I guess we'll see you tomorrow.
Yep, I'll see you tomorrow morning.
Okay, well, safe travels down.
Thank you.
All right.